Valley Health Systems. Whether you're new to our organization or interested in becoming a member of our team, there are so many things that make Valley Health special. A recognized leader in community-based healthcare since 1975, we are an organization that has been at the forefront of taking healthcare to places where people need us to be. Because of that, hundreds of thousands of people in the many communities we serve have healthier lives today because they've placed their care in our hands. We are the community.
Valley Health is extremely important to the community because it is probably the only resource for healthcare, community-based healthcare in the tri-state region, where we have not only staff involved, but also our users of care involved in directing the services. Essentially, Valley Health is owned by the community. So that differentiates us from all other healthcare providers in the tri-state area, and for that matter, in the nation.
We are a patient-centered medical home.
The patient-centered care and the patient-centered medical home has several components. The first component is that when we are practicing medicine, when we're taking care of patients, our first goal should be to care about what happens to the patient. So the first tenet of patient-centered care is really practicing using evidence to achieve goals that are going to impact the patient's quality and quantity of life, how they're doing as a person. The other really important component of patient-centered care is that we need to remember to consider the patient's perspective when we're managing care. We need to consider the patient's belief systems, the patient's attitudes towards care, and what their hopes are, what their goals are.
My doctors do listen to me, and they try to make plans around what I like to do. Like, I want to walk, I want to exercise, ride bikes. They listen to what I have to say, but they put it in terms in what is best to manage my diabetes from day to day.
Quality is our commitment.
Valley Health's philosophy of caring for patients is to provide the highest quality of care. We want to make certain that the patient experience is one that knocks your socks off.
Providing quality care means knowing what the research says is effective for these patients and being able to effectively adapt what the literature says to the specific patients that we're seeing with their own concerns, their own limitations. And that's what our commitment to quality care really is.
We ensure quality by monitoring a variety of clinical measures and preventive care measures to see how we as an organization are doing in terms of providing care that are based on nationally accepted guidelines. And we do this annually with a number of measures as part of a federal audit, but we do so internally on a regular basis. We talk to our staff daily about quality, and in a more formal setting at monthly quality assurance meetings. We assess how we're doing, we implement a change, and we reassess later to see if that change made a difference. And we do that on a continual basis with any number of clinical measures.
We believe in a team-based, integrated approach to care.
We have team-based care with integration of behavioral health in a way that most other organizations don't yet. We also have clinical pharmacists, psychologists, we have health coaches and population health advocates. And what these folks do is they work as part of the team to get patients the best care that we can give them.
When I think about what has been most rewarding about my experiences at Valley Health, it really has been utilizing the team approach that we're set up to have to provide that care. For example, I can think of cases where the psychiatrist and I have worked with a child who had a lot of depressive and anxiety symptoms initially, and we were able to address those symptoms, get them re-engaged in school, re-engaged in extracurricular activities. And I really think that the team approach and that integrated care level that we have allows us to do that as effectively as we can.
Why is Valley Health a special place to work? Valley Health believes in its employees and is dedicated to making our organization an extraordinary place to work. We are cutting edge.
Valley Health offers opportunities for providers that other organizations do not or may not offer, in that we are really on the front edge, the leading edge of managing patients in the changing healthcare system. We have been really on the forefront of keeping up with the changing payment models that are happening in healthcare. And so when we talk about things like patient-centered medical home and accountable care organizations and shared savings and all the other things that physicians hear about, Valley Health has recognized those changing systems pretty early on and has stayed ahead of competitors. Everybody's going through these changes, but I feel like Valley Health is probably a step or two ahead of most people.
I think the other opportunity is the fact that we have the chance to do what we do. We're providers. I'm a clinician. I'm not an administrator. I'm not, I don't worry about dollars and cents and those type of things. I get to treat patients from the heart and get to be able to do what I feel is very important for the patient.
We are more than just a workplace. We are family.
I work with a team of providers that care about each other. The staff cares about each other, so you have another family outside of your home. They put their employees first, and our needs as well are very important as well.
We provide opportunities to grow in your career.
I think I would want other providers to know at Valley Health that if you come here, there is room for you to go into the company. You could become anything that you want to be here because there's opportunities to grow in any profession here at Valley Health. Even though it's a local company, it's a big company, and there's always new positions open.
I'm a prime example of folks that can grow in their careers at Valley Health. I began as a family dentist, and I was the one dentist that Valley Health had when I first started here. Through the years, 32 years later, we have a number of centers, a number of dentists, and I have the opportunity to be speak on a national basis for a number of organizations that promote oral health access. I've had the opportunity to become a faculty member at West Virginia University School of Dentistry and teach dental students here in our centers. For 32 years, I never regretted one day of being here with Valley Health.
There are so many great employee benefits.
One of the main benefits that I see when I talk to my colleagues is that we, as providers, have a lot of autonomy in terms of our schedules and our day-to-day lives. We have many opportunities at Valley, but we don't require most providers to do the things that we offer, things like urgent care and newborn nursery hospital work if you're a family physician or a pediatrician. We let our providers have a lot of flexibility in how they schedule their days, and so I think when you are balancing work and home life, the quality of life becomes really important for providers, and Valley Health really recognizes that and wants to keep our providers as happy as we can in their work life as well as their personal lives.
One of the very unique things about Valley Health is the opportunity for providers of care, whether it's physicians, dentists, behavioralists, psychiatrists, licensed social workers, licensed psychologists. There's a huge demand for care. We do our best to wrap ourselves around those clinicians. We work with them for getting loan forgiveness, to get them into an opportunity to be happy in their profession. We do whatever we can do to give our providers an opportunity to expand their own vision of what they want to do in the care that they want to provide.
Valley Health. We're all this and so much more. Join our team, our family, as we continue to serve this region, taking primary care further than it has ever been before. It all starts with you. There's no limit to where the journey will lead.